Good evening. Good evening, all. I am Dr. Soumyadip, MBBS, MD in General Medicine, presently practicing as physician and consultant diabetologist attached to Malda Medical College Hospital, Malda. Our today's discussion will be on high blood pressure. This is in terms of calling hypertension as a physician term and high blood pressure in layman's term. Now, everyone would like to have a healthy and normal blood pressure, but what exactly does it mean? Actually, when the heart beats, it pumps blood into blood vessels. Now, this way it creates a pressure against the walls of the blood vessels. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day, but when the blood pressure remains high for a longer time of period and it is left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Now, hypertension usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, stress, etc. Now, there are some other risk factors that can also increases the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and can be narrowed as excess fat accumulates. Next is family history of high blood pressure. One or more closely family members with hypertension increases people's risk for developing the condition. Next is excess salt intake. Third is not eating enough foods with potassium can increase the blood pressure and risk of stroke and chronic kidney disease. Eating processed and fatty food increase fats throughout the body and make the heart work harder to push blood throughout the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity, further to high blood pressure. Now, and the last but not the least is stress. In modern lifestyle, reacting to stress in unhealthy ways or not managing stress can also lead to increase in blood pressure. Now, moving on, hypertension does not have obvious signs and symptoms. That is why it is often called silent killer. It puts people at risk for several diseases, from cardiovascular problem to kidney disease to stroke and to eye blindness and eye damage. So early and accurate diagnosis is very important. Management of hypertension. Measuring the blood pressure is only one way to know the person who have high blood pressure or not. Now, coming to blood pressure measurement, it is measured by an instrument called sphygmomanometer, which is readily available in every clinic. A person can easily visit a physician or any doctor's chamber or clinic to measure his or her blood pressure. Now, normal blood pressure reading has got two readings. An upper one, it denotes systolic blood pressure. Lower one denotes the diastolic blood pressure. What is the difference? Systolic blood pressure means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, which means pressure in the blood vessels when the heart rests in between the beats. Now, the normal reading is around 120 to 140 systolic millimeter of Hg, and in diastolic it is 80 to 90 millimeter of Hg. And if the person has blood pressure readings more than 140 by 90, the person is said to have hypertension. So diagnosis part is very easy. Just now I described. After that, how the risk is prevented and what are the popular steps or the strategy to control blood pressure or to have a healthier lifestyle. Starting with first as regular exercises, next is healthy diet, next is quit smoking and alcohol intake, next is regular blood pressure monitoring, stress management, and adherence to medicine. We'll describe each and every point in a nutshell. So let's take a look at these strategies one by one. First is regular exercise or physical activity. Exercise can be drug-free approach to lowering blood pressure. Regular physical activity makes heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. And if the heart has to work less to pump, the force on the blood vessels will decrease, and that way it lowers the blood pressure. In other case, as we all are aware that age and weight gain are the two major risk factors for high BP. So if the blood pressure is at a desirable level, that is around 120 by 80, the exercise can help it to prevent it becoming rising as you age. Now, what are those exercises? Regular exercises means to maintain a healthy weight. It can be walking, jogging, or swimming. And a person has to at least minimum 30 minutes of aerobic activity most days of the week. That is at least around 5 days a week. Now, coming to next strategy is having a healthy diet. Diet plays a major role in controlling blood pressure. A person with high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure and to prevent hypertension, one can adopt a dietary pattern such as DASH diet. DASH stands for Dietary Approach to Stop Hypertension. Other type of diet a person can adopt is Mediterranean diet. Or if I break into some groups, we can have less saturated fat or total fat in his diet, getting plenty of potassium in his food, or limiting amount of sodium in the diet, and of course, limiting alcohol consumption. Now, what is this DASH diet? DASH diet consumes compromises of eating food rich in whole grains, fruits and vegetables, and low-fat dairy products. And a person should consume low amount of saturated fat and cholesterol. That way, a person can control blood pressure by up to 11 millimeter of Hg. Next is reducing sodium in the food or in your diet. How can we prevent intake of sodium? Person needs to avoid fewer processed food because processed food generally contain high amount of sodium. So one can have less processed food or one can avoid this type of food. If at all he has to take these, he should read the food labels because the food labels can be guideful and can guide us to have a low sodium alternatives of the foods. Next is don't add salt. Just one level teaspoon of salt has around 2.3 gram of salt or sodium intake. So avoid adding salt to food. You can use always an herbs or spices to add flavor to your food, but not salt, not sodium. Next is quit smoking. A person has to quit the smoke. Quitting smoking can effectively reduce the risk of heart disease and improve your health overall. Now, after this, we are coming to blood pressure monitoring. Monitoring is very helpful in terms of regulating blood pressure. You should visit your doctor or clinician regularly. Otherwise, most often I advise patients self-monitoring of their BP levels through automated digital manometer. It measures self-monitoring helps persons to measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get a more complete picture of the person's blood pressure reading at different times. Further, helps us in the better prediction of cardiovascular morbidity and mortality, rather than single routine blood pressure measurement during our visit. Next is stress management. By learning how to relax and manage stress, can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercise, listening to music, focusing something calm and peaceful, or meditation. And of course, after all this, if the person is advised to take a regular medicine, he has to follow this regularly. That means adherence to medicine. If your blood pressure is consistently high or usually at and above 140 by 90, adherence to medicine is very important. So, at last, I would suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you. This is in a nutshell about hypertension. Thank you.